But our first speaker for the second half, he's a maker of many kinds. And it just so happens he's the first speaker at Ignite in Hampton Roads it's his second appearance at Ignite because he was so good at the last one. But this time he's going to talk about something important to all of us, I think. Mr. Bob Armstrong.
Thank you, Rich. Hey, can everybody hear me okay? Just to start off the second half, I want to ask all of you just to please recognize with applause Rich Mormon and the gang that puts this together. They all do a great job, and it's all volunteer. They lug their equipment in here. They're really putting a lot of effort into this, and guys like me don't. I get to show up and not do anything but grab a mic and act like I know what I'm talking about. So let's go. Let's roll it. Okay, so my name is Bob Armstrong. I'm going to talk to you today about why you need to be aware of and why you should care about medical modeling and simulation. I work at Eastern Virginia Medical School running a medical modeling and simulation research program, and it's something I care a lot about. So I want to share that care with you. The current medical educational system, the system by which we educate people in the United States, is 120 years old, just like this Chinese guy behind me, okay? 120-year-old man, that's the same age of our medical education system. It's built around the concept of see one, do one, and teach one. So you visualize a problem, you practice that problem, then you regurgitate that skill set, okay? That's that's my elevator speech for the medical educational program. An interesting thing is that it takes as much time to become a qualified physician as it did for me to raise an 11-year-old and a 16-year-old boy. Okay, and the 16-year-old's in the red sweater down here, so just make fun of him later. So that's a lot of time. It's also very expensive. It's like buying a car every year when you're in medical school. These are Volvos. They happen to be between $28,000 and $43,000 in price, just to give you an idea. That's a lot of money to be putting into an education. It costs a medical school $120,000 a year just to educate one student. Okay, and that's because physicians who are professors cost a lot of money, and they're a big part of it. That's about how much one of these crazy cars costs. So we're putting a lot of, we've got 120 years of experience. We've got a whole lot of money going into this. We think we know what we're doing. We've got a pretty good healthcare system, right? I think our healthcare system is great. Our educational system is great. We can make it better, though, okay? Why do we need to make it better? Because we kill 45,000 people a year with preventable medical errors. That's a lot. That's a fifth of the population of Norfolk. That's 6 times the population of my town of Smithfield. We can fix a lot of these problems via simulation, hence why I'm here talking to you about this. Simulation is in the medical realm is about presenting problems and situations to students so that they actually have an opportunity to repeat those things and get much better at it. Simulation is very nice. It's a great way to look at a problem and see and to learn how to solve a problem without actually having to poke a human. The list up on the board back here is a list of different medical procedures that a physician has to master as part of their educational process. Every one of them involve either something being stuck in you or you having to be pregnant. The intubation is a very challenging one, and we're going to stick on that one a little bit. Intubation is sticking a tube down somebody's throat into their windpipe to drain fluid or do some other things. It's a very challenging procedure because you can't see what you're doing. You can break teeth. You can damage the trachea. You can scar a person. We don't like doing that and learning that sort of stuff on real humans. We do it via simulation, like this crazy dummy right here that's got his chest open. You're certainly not going to do that to a live person, right? Think about these little guys like babies, okay, and this is a plastic baby. This is not a real baby. You don't want to learn how to do a trachea on a live, intubation on a live baby. You want to be able to do that and practice it in simulation. Now, mannequins aren't the only thing we have. We also have these virtual devices, okay? Virtual devices represent parts and pieces of the body in very high fidelity so that you can practice and do things as a physician in training that would ordinarily be very, very challenging to do on a live person because, again, you're poking and prodding. Situations like this where you really have to get involved in dealing with the patient and treating the patient you're much better off learning those things as in a simulated environment. We also have a cadre of actors in our particular community that actually represent patients in specific illnesses, which help teach physicians how to have good patient-doctor interaction. So let me tell you a real quick story. There is a children's hospital, and it's not in our area, so it's not CHKD. There's a children's hospital that was having a problem where every 147 days they were having a very serious, significant incident where somebody died, 146 days. They injected simulation purposefully into their training program at the hospital, and they moved that bar to 120 or 1,270 days between incidents. I think that sells it for you, okay? I hope it does. So simulation should matter to you because it's going to create a doctor that's courageous enough and confident enough to sit out on the bar out here all by himself, suspended, and fix you in a way that is not going to hurt you. So I can tell you more about it later. All right.